and the FeldCare Connects podcast with your presenter, Neil, the media giant Haley. And I have another really interesting guest. We've had some physical therapists on, and we also have had some speech therapists on, but we really haven't gone in and dove into somebody who helps make them. Going to the universities, and it kind of reminds me of the days when I was a practicum teacher, where I would work with potential teachers in the classroom or supervisor, and I got those opportunities back in the day when I was. So our guest today is Andrew Bartlett, Professor Dr. Andrew Bartlett, from Cal Northridge. How are you, Andrew?
I'm
Thanks for stopping
I'm
by.
fan yeah, I'm fantastic, Neil. I'm excited. Let's go.
Yeah, let's rock and roll. So first, tell us about physical therapies. What does a physical therapist do?
Physical therapist does not do massages.
Okay.
We do we that's kind of old stereotype of PTs. Oh, we do massages. No, we are well versed in a lot of different practice settings. Practice settings include, your typical orthopedic outpatient clinic. So, from knees to hip injuries to, but we also work in the hospitals, from acute care to ICU to, traumatic brain injury. So as well as we work in pediatrics and we work in home health, which we'll be talking a little bit more about. And we work in school settings and we work in private practice. So we are, I think as a PT, it's one of the best jobs because we are very versatile to go into a lot of different practice settings. So I'm excited to talk about PTs as well as any other healthcare professions.
What I love about what you talk about is specifically there is so many options to become a physical
Yeah, for
therapist.
sure, for sure.
And why do you think people decide to be a physical therapist?
Well, you hope people get into physical therapy because they really care about other people and making them better, whether it's athletes or whether it's kids working with older adults or senior athletes. So hopefully the main intention is to get in to make somebody better, to improve their performance, to increase their quality of life. And then I think another reason that hopefully people get into it is because of that versatility, from traveling PTs, checking out Hawaii, checking out Chicago, checking out Pittsburgh, checking out California, to going into different practice settings, like I mentioned earlier, with hospitals to outpatient and so forth. So versatility, the quality of care that we can provide our patients slash clients, and then financial stability for sure.
When your students graduate, they have plenty of different opportunities, but they also might like the flexibility students, right? And
Yeah.
what is the opportunity for them to become an entrepreneur, clinician at a young age, or depending on what just graduating out of by partnering with FeldCare? How big an opportunity is that for them?
It's a great opportunity. It's funny because I just yesterday in class, I teach geriatric. Among a few other classes, I teach geriatric management. And we had a great guest speaker in Chris Chimente, who is a vice president at Home Care of Rochester in Rochester, New York, but also very well established public speaker within the American Physical Therapy Association. And we talked about home health. We talked about the great opportunity for students in terms of entry level students who just graduate to get into home health and get into that entrepreneurship of seeing patients and really making a name for themselves. The old stereotype was a new PT coming out of school. That home health environment is too much for them. They can't handle it. They're on their own. They don't have the the organization skills. They don't have the teamwork skills. But that's a myth. And with the right agency such as FeldCare, the young professionals, the young PTs, or even PT, or even students who go back for PT career might not be so young. You know, we
Exactly.
have we have somebody who's 50 years old in our program. Oh yeah, so
Yeah.
it's opportunities for a lot of individuals coming right out of school to jump right into um, entrepreneurship such as FeldCare and do great service as well as make some nice money.
And Andrew, you do the same. So you model it for your students, right?
I do, I do, I
And so
do.
talk about partnering with FeldCare, how that's giving you some flexibility. and the ability to be an entrepreneur.
Yeah, so even before I became a professor full time, I was a PT within the home health setting in New York. And I love home health. I think it's just a fantastic environment to really see the family, see the patient, and to work on those functional stuff right inside the home and in the community. It's a great, just fantastic. So when I moved to California to take a teaching job, I heard about FeldCare, heard great things about it. So I contacted Randy and had a great connection and started seeing a few patients on my caseload while still working full time. And I've been able to do that for geez, maybe three and a half years now, keeping a small caseload because I teach full time. But for me, yeah, the extra money is helpful, but it's not the primary reason that I'm doing it. I'm doing it because I love home health, first of all, and then also gives me great experience to bring back into the classroom. The students don't want to hear just book talk and PowerPoint talk. They love to hear about patients and their families and stuff. So for me, it's a great opportunity, and who knows, maybe somewhere down the road, maybe that'll be a full-time gig for me. Just to work for FeldCare. But right now I'm teaching and just doing a little bit of home health. So yeah.
When I think of second career, all right, so I
Yeah.
have second career. I was former professional wrestler. I don't know if you know all
What?
about my back.
I
Yeah.
did not
Yeah,
know
yeah,
that.
yeah, yeah, yeah. And then I went
Oh,
back to become a teacher and I got my master's degree in education at Duquesne University. So I would go to the different classes and the teachers that were still teaching that were professors were way better. It's like, okay, you're firsthand working with the students still. Oh
that's
my
great.
gosh, it's fantastic versus the ones that are not. You're like, okay, you're going to get so much more out of that process. So that's really cool that you're still doing that and see it as such an important thing. So I'm going to ask kind of the same questions I've asked other therapists that have come on
Sure.
FeldCare Connects podcast.
Love it.
What are some of the biggest challenges you faced transitioning from being an employee to running your own business, and how do you overcome them?
Hmm. So I would say the biggest challenge of you know, kind of being entrepreneur at FeldCare, so to speak, um, is maybe just a little bit of time management, trying to organize myself to still do the teaching and still see some patients on the side. So maybe that is one of the bigger challenge. And then time wise, in terms of scheduling, unfortunately, I'm a morning person. When I say morning person, I'm early morning. I'm too embarrassed to even tell you what time I get up. And even saying that, most of my patients, they don't want to be seen until like 12 o'clock, 1 o'clock, because they sleeping in, they got their medications and so just kind of the time of day is, I'm not too crazy about working a little bit later in the afternoon. I'd rather see people in the morning and early afternoon. So, just other than that,
Okay. Okay.
pretty
All
smooth,
right.
pretty smooth, pretty
I, li-
smooth.
I like when you say you're a morning person and not having to be able, but there is some flexibility and I guess having control over your schedule, especially being a professor,
Yeah.
uh, with a patient caseload, improve your work-life balance and overall job satisfaction because now you want to be in the field. You have the opportunity now to do that
Yeah.
and still be a professor. That's pretty cool.
Yeah. And you bring up a great point. It's probably one of the biggest advantages of working for FeldCare is, and any home care, pretty much a lot of home health agencies, but definitely FeldCare is the flexibility. You make your schedule with your patient, in the family, you're trying to meet their needs, but you can go to your doctor's appointments, you go see a ball game, you can catch the Lakers, you can do whatever you want. Um, or I don't know if you're a big hockey player or hockey fan or what in Pittsburgh and
Penguins,
stuff.
Penguins, yeah.
Penguins, yeah, that's what I
Uh,
figure.
yeah.
Yeah, you
You're
can make your own
winning
schedule.
way more than the Penguins now.
Oh yeah. So yeah, you make your own schedule. You make your own schedule and the flexibility is off the chart. I mean, you can see people on Sunday, you can see people on Saturday. You can take part of the week off if you want to. So it's fantastic.
And I think students see that as how cool is that, right? I could go
Yeah.
work a certain amount of hours, then take a longer vacation and not have to tell my boss, sorry, hey, I'm just going to take a longer break. You're not going to get that flexibility working in an institution or somewhere else and say, I'm going to take 2 or 3 weeks off, or I only want to see patients 2 days a week. That you don't
And
have to.
student, yeah, and students nowadays cherish and expect and appreciate the flexibility and quality of life. Those days of working, 12 hours, the students want nothing to do with that. They want quality of life. They appreciate the other stuff in life besides just work. So the flexibility is important for them for sure.
What are some key benefits of using FeldCare and Clinique Connects to support your business operations?
I think they do a fantastic. I think FeldCare does a fantastic job in terms of getting patients for us. So we don't, and it's one great thing. We don't have to go out and search for patients from hospitals or to outpatient clinics. They come to us, meaning they come to FeldCare and the signing team, the staff that's on in FeldCare. They do a great job connecting the patients to us, and they do it very smoothly and seamlessly. So I appreciate their professionalism. They send us a text that says, Andrew, could you take a patient in such and such area? And I say yes or no. If I say no, they say no worries. Thanks for letting me know. Simple as that. And if I say yes, I'll take the patient. They say fantastic. I'll be sending the information over to you. So it's no pressure, no worries, no stress of having to take a patient if you can't fit it in your day or in your schedule. And they fully appreciate it if you can take it. So they do a great job with their professionalism.
Absolutely. And can you speak of Clinique Connects a little bit? Part of that, you talked about the FeldCare. What about Clinique Connects? And what?
Yeah, the software programs and the computer program that we use for data for entering our data, simple, functional, easy to use. It's smooth, and they do a great job on the back end with quality assurance. Like just for example, just this morning, I finished up a documentation on a discharge for a patient, and I forgot to put a note in to let the doctor know. And they emailed me today saying, Andrew, thank you for putting in for your great discharge on such and such patient. When you get a chance, please, just a friendly reminder to put in that note for the doctor. So, oh, thank you. Forgot all about it. So they do a great job with that. Yeah.
That's gotta be cool. I mean, like I said, if you have paperwork and you can make it seamless, makes life
Yes.
easier. I remember when I was an
Oh,
intervention
no.
specialist, birth to three, it was crazy, Andrew. I mean, absolutely crazy. I'm having to fill out paperwork with tools in
Paperwork.
my bag and
Yeah.
doing like this. And it's
Those are the paper days too, right?
yeah,
Yeah.
there's no, we'd have to
Uh,
do the paperwork in the house. We weren't allowed to do it. It had to be during the billable time. We couldn't go back and write our notes after because we had to give a
oh, okay.
copy. So we're filling
Got it.
out the papers and
Old
writing them
school.
all
Yeah.
out. Oh, yeah, that was years ago. But what I'm saying is, if you can make things seamless, it's easy that you don't have to have everything, all these papers and all this different stuff, and make life easier as a therapist. That's great
Oh,
because
yeah.
not all places like FeldCare are like that, right? No.
No, that's 100% correct. Is that I think the one of the dings on home health in terms of the umbrella is the amount of paperwork and the forms and the documentation. Feldcare and Clinical Connects, they've made it smooth, quality, but smooth, in terms of the way they put the forms together. We're looking at functional measures and quality measures, and we document. And if we forget to add something, they just remind us that, just to add such and such information into the chart. So it doesn't take long to document. So
It's fabulous for sure.
yeah.
We didn't talk about a specific success story. I like the success story of going and
Oh,
catching a Lakers game.
okay.
Can you share a specific success story or milestone that you made that you feel confident in your decision to become an entrepreneurial clinician?
A success story of how let me come back. Geez, um, Rephrase that question for me. Let
So
me
basically,
give you a
just
chance.
so just how you felt confident about making that decision. Tell me a story. You felt confident in the decision of becoming an entrepreneurial clinician.
I guess the only thing that comes in mind is when I first started working for FeldCare, um, the first few patients that I saw reminded me because I had a little time off in between, relocating and stuff, reminded me the importance of home health and working with patients in their home setting. And it reminded me that working for a great company and a great CEO and great staff is worth it. So just to refresh my memory on how much I like it, and I like it so much that I'm a big advocate for home health. I hope my students go into that field. It's one of the fastest growing professions in terms of within PT. Home health is
Wow.
off the chart. As we get a little bit older, our aging population, more people are needing PT. And then, I'm a big proponent of patients and clients getting PT early, meaning, yeah, why we don't have like why we aren't set up like a dental model, meaning the dentist. Think of the dentist. You go in every 6 months for a checkup, right? We've been advocating as PTs to do this and to get paid for it. So you come in for a 6 month checkup. We check you out. We check your balance. We check out your strength. We check out every. We do full body assessment, examination, fitness exam. We say, Neil, you've been killing it, man. Fantastic job. Vitals are great. I'll see you in 6 months. Or you know what? I see that you have a little bit of limp on that right side. And then maybe we give you some specific exercises to address maybe that maybe some weakness in the gluteal muscles or something to help prevent you from getting osteoarthritis in the hip or the knee. And that prevention, that's a whole nother conversation. And then, I'll see you again maybe in a few weeks. And it just, it's just fantastic. Yeah.
What advice would you give other therapists that are considering doing partnering with FeldCare?
I would say, besides just doing it, I would say, contact somebody within FeldCare, contact a PT or an OT or any of the healthcare professions that are currently actively involved with FeldCare. And if you're not sure, come out for a ride with us. Come see a patient with us. You can shadow us and you can get more information, and you'll see that it's a great opportunity to whether it's full time, part time, or whatever. I think it's a fantastic company to work for and a great opportunity for PTs, OTs, as well as other healthcare professions to get involved with. So I think they're missing out if they don't get involved with it.
You're bringing back so much of my home health experience at early intervention specialists in Pittsburgh so many years ago when I was a
Hmm.
developmental therapist, worked at three. The most rewarding time, and that's why I started an in-home tutoring business and really focused on going into the home, was that reason. Because once I became a teacher, I said, nope, I got to do the same model I was doing birth to three. So I was doing birth to three developmental therapy while still student teaching and doing all these different things. And I moved into the other and left that. But I said, I got to do the same model for tutoring. And it was the most rewarding when you go into your home, people feel so
Yes.
much more comfortable to
Yep.
work with you and to work on their milestones and see that growth. It's
Yeah.
huge. It really
And
is.
and then seeing the family,
Family atmosphere and the family
yes,
dynamics and
and the community going into the community. I've got, when I was working in New York, I worked in some, pretty rough areas. But I can tell you that when I came in that area, everybody was so appreciative of the healthcare professional coming in, treating their grandmother or treating their dad and their mom. I remember tons of occasions where, the kids might be out there, playing dice against my tire or have a beer can on the car, and the grandma come out and say, "What are you doing? Get off!" And then say, "Oh, I didn't realize he was in there." And so it's the community embraces us, and it's wonderful to see, and it's good for us to be involved with a lot of different communities.
all right. So the best place to go is feldcareconnects.com. Appreciate it, Andrew. And is there a
Oh, you're
place we can
welcome.
check you out? go to the university
Oh
website?
yeah. You can go on Cal State Northridge website under faculty, and you can see me as I have a young picture up, so that gray hair won't be there. So you can check out my file there, and then you can certainly connect with me on my email, which I can give to you now or
Yeah,
later.
go ahead, do it.
Okay, yeah, you can do Andrew dot Bartlett, just like the pairs, Bartlett at gmail.com. And then be happy to chat or connect you with other resources if needed. So
All right. Thanks, Andrew. Appreciate it. That
you're
was a
welcome.
special simulcast of the Neil Haley Show on the FeldCare Connects podcast, guys. Take care.